Good morning. I think I'm supposed to start. My name is Doug Rizzo, and I'm one of the senior scientific directors at the CIBMTR. I'm a clinical bone marrow transplant physician, still my passion. And I've done research projects in late effects after transplant, including standardized mortality ratios and second cancers that occur after transplantation. So I'm really happy to moderate this session, this next session. You've heard from our first session speakers a foundation upon which to consider complications of transplant as a curative therapy that may lead to disability. So fundamentally, transplant often includes intensive chemotherapy and is subject to immune consequences based on HLA matching between the donor and the recipient and immunosuppression related to the procedure. Substantial numbers of recipients are children or adults of working age. As you've also heard, recipients of transplant, although they generally experience high long-term survival rates, they do not necessarily achieve the population normative survival rates, and they have significant late effects that affect their morbidity, their mortality, their work status, and very importantly, their quality of life. There are estimates that between 50 and 80% of survivors have chronic conditions after transplant, and changing trends in transplant, as Dr. Lee pointed out, which may be targeted to improve complications that lead to disability, could also increase as the number of recipients and survivors increase. And so the overall number at risk will increase, and there may be other complications associated with new approaches. I think you can say that as we innovate, we also learn more complications of our innovations. So you'll see a few examples of those trade-offs in the upcoming presentations. Some of these late effects are consistent with those that are experienced by other cancer survivors, as we've already touched upon in the first session. But they may be more severe. They're usually more severe. And there are studies that demonstrate that there are some unique chronic conditions that affect transplant recipients, especially infection and respiratory conditions, and that these may also influence disability. Children generally do better than adults, but as you'll hear from Dr. Davies, there are consequences also have bigger long-term implications because of the longer span of survival and to acquire risk from their treatments. Our speakers in this session will focus on immune recovery, graft versus host disease, and specific considerations in childhood recipients. And while relapse is an important consideration, we focused on other late effects in this session. There will be three speakers for this session. The first is Dr. Miguel Perales, who's the chief of the Adult Transplantation Service at Memorial Sloan Kettering in New York, and associate professor of medicine at Weill Cornell Medical College. He'll speak about immune recovery after transplantation and touch on immune recovery after cellular immunotherapy. Dr. Betty Hamilton is the interim director of the blood and marrow transplant program at the Cleveland Clinic Taussig Center and an associate professor of the Cleveland Clinic Lerner College of Medicine of Case Western Reserve. And she'll describe complications and late effects impacting adults following transplantation, in particular chronic graft versus host disease and early studies in disability for chronic graft versus host disease. And finally, Dr. Stella Davies will be discussing complications and late effects specific to pediatric and adolescent young adult populations. She's the director of the Division of Bone Marrow Transplantation and Immune Deficiency at Cincinnati Children's Hospital Medical Center. She directs the Cancer and Blood Disease Institute at Cincinnati Children's and is the Jacob Schmidlap Endowed Chair and Professor at the University of Cincinnati in the Department of Pediatrics, and the president of the ASTCT. Their bios can be found on the workshop website. And similar to the first presentation, following the prepared remarks, we'll join the speakers in a panel discussion. So in addition to paying attention during their presentations, I would ask that you use the chat box to enter any questions that you may have. With that, I'll ask Dr. Perales to begin the first talk for this session, please.